Despite the coronavirus pandemic, the staff at Texas Organ Sharing Alliance remain dedicated to saving lives through the power of organ donation throughout our service area in Central and South Texas. Joining us for this week's TOSA Talks is Lisa McCoy from our Southern office in the Rio Grande Valley. Thanks for joining us, Lisa. What is your role in the donation process, and how did you end up here?
So I am an organ recovery specialist in the Southern region, and our team covers every hospital in the Rio Grande Valley, which is really a pretty big area. I work 24-hour on-call shifts, and I coordinate all aspects of evaluation of potential organ donors. I coordinate with our family services coordinators for authorization. I do donor management, organ allocation, organ recovery. I mean, that's really just the tip of the iceberg, but pretty much everything from the time the hospital staff refers the patient to us, who may progress to brain death, till the time we complete OR, and every gift is on its way to the recipient. So prior to TOSA, I was an ICU RN, and I did a short stint in PACU and outpatient surgery before realizing that I wanted something more. I needed more critical thinking. I wanted something more fulfilling, that I felt like I did something more meaningful. And my life had been touched by a few different people who were recipients of organs, whose lives were saved by organ donation, and I'd already been interested in all aspects of organ donation. So I stumbled onto this position by meeting another RN who had worked for TOSA at the time on a local area moms Facebook group. And one thing led to another, and I applied for a coordinator position in the Austin region. I was hired as a coordinator there, and I worked there for almost 4 years before transferring to the Rio Grande Valley last October. We're working really hard to develop this region, who previously didn't even have full-time clinical staff.
As COVID-19 is affecting all of our communities, hospitals are creating different policies to manage the people that are coming in and out of their facilities. How are these hospital policies affecting you in your day-to-day activities?
Oh my gosh. It has greatly affected every day-to-day activity. Every standard practice that we follow has been upended and changed in some way. Prior to COVID-19, we rounded on all patients at every hospital every day. Now we perform most of our work remotely. We're only in the hospitals whenever we absolutely have to be, and we always wear our PPE, like our masks, the entire time while we're on a hospital unit. And if we have consent and are working a donor case, that could be up to 24 hours, where we only take it off whenever we isolate ourselves to eat and drink, or go to the bathroom and have a breather and blow our nose for a minute, maybe brush our teeth or pop in a breath mint. This pandemic has affected every single coworker of mine, even our family services coordinators who have family conversations about donation. They don't even go on site anymore. We utilize our dear friend Zoom here to facilitate all interactions between families and all of our family services staff as well.
Wow, that's incredible. So you did mention PPE and kind of staying back from going into the hospitals, but what other ways are you keeping your safety a priority?
So as an RN, caring for others is my heart and soul, and I'm very passionate about the work that we do with organ donation. And the only people that are more important to me are my family. And if I don't take care of myself and protect myself, then I'm at risk, and also I put them at risk for contracting this as well. I have young elementary age boys. So we practice social distancing. We are very respectful of other people's space whenever we have to run an errand. We wear masks in public. Even my 2 little boys are good about wearing their face coverings. They think their masks are cool because I have them with sharks or dinosaurs or an outer space print. We wash our hands regularly, and I've also taught my boys to sing their ABCs while they're washing their hands to make sure that they wash for long enough and don't rush through it. And as I already mentioned, we only go to the hospitals in person when absolutely necessary, and I make sure to protect myself at all times while I'm on site.
Great. And of course, at the start of the pandemic, TOSA, through a partnership with University Hospital in San Antonio, opened the Center for Life, a state-of-the-art facility dedicated to organ, eye, and tissue donation. Now that donors from across our service area are being transferred to the Center for Life, recovering more than 100 organs for transplantation since March, TOSA is able to save more lives and ease the burden off of our hospital partners. What other benefits are you seeing?
So transferring patients to the Center for Life in San Antonio couldn't have come at a better time. With this pandemic that is debilitating to our healthcare systems and our hospitals being overwhelmed with admissions, we can now transfer our patients to our highly specialized unit that is solely for our organ donor heroes. We don't have to worry about taking up a hospital bed in the ICU when there's more sick patients in the ER who are just waiting for a room. We test all of our patients for COVID to make sure that they haven't contracted the virus, and before we set up transfer to the CFL. And it also allows our hospital to support organ donation while allowing for the hospital staff to focus on their critically ill patients. It helps that families know that their loved ones can have a greater impact as a donor. We've had greater donation outcomes since transferring our patients to the Center for Life. And as I mentioned, this highly specialized unit has RNs who are familiar with caring for organ donors. We're able to provide high quality care to our donor heroes while working to honor their legacy and save as many lives as possible.
I know this time probably in your career is going to be a very unique moment that you're going to remember forever. But are there any other experiences or moments in your time at TOSA that stand out?
I have so many moments that will forever stick with me. And most of them revolve around the selfless families who are so inspired by organ donation. Some of the ones that really stand out the most are the donor families who we meet later as they volunteer at events. They tell us that organ donation and our care of their loved one was a beacon of light for them, that they have now found peace with losing their loved one, knowing that their legacy lived on and that someone else has life because of the gifts from their family member. Those words are the most powerful motivation that I could ever ask for. And especially now, whenever we have to push forward in really difficult times like these.
Well, Lisa, thank you so much for joining us to talk about the important role that you play in TOSA's mission to save lives. We appreciate your efforts and our entire clinical team who work every day to give hope to the thousands of patients that are on the transplant waiting list. If you enjoyed this episode of TOSA Talks, we hope that you tune in next time. Until then, you can learn more about organ donation and how you can sign up to save lives at tosa1.org.